Well, thanks for joining us today at the Torrance Memorial New Main Tower project. It's summer of 2013, and today we're visiting with Dr. John McNamara, Chief Medical Officer at Torrance Memorial, so that he can tell us a little bit about spaces just like the one that we're in now. The space that we're standing in right now is the family waiting area, and we have one of these rooms on every floor of the building. What makes this space in this building so special?
Well, I think there's a lot of light, and the light makes the area feel much less like you're in an institution than a lot of old hospitals. And the light will be a calming influence for families, especially this floor, the operating room. The families who have a lot of stress, and it'd be nice to be able to look out. Pretty nice view outside, so I think that'll all be good.
Well, why don't we step out of the family room and take a look at PreOp while we're up here and show everyone what we've done with design in that area.
Let's go there.
We're in an area that we call PreOp, and obviously where patients reside before they go to surgery. And it's obviously under construction, but when it's done, what will give this space that special touch?
Well, this space looks like it's about twice as large as the spaces we have now in PreOp, because many of the older hospitals really weren't ready for the amount of people who come in straight to the hospital to go to surgery. So in this area, it'd be much more private for the patients than what we have now, and also the family members will be able to stay with the patient until they're ready to go to surgery, which is going to be a big help for both the patients and the family to be able to see the family member off. It's part of our patient-centered initiative to put the patients near the outdoor light rather than the offices near the outdoor light. So I think this is really going to be a nice area for pre-op patients.
We've been talking about the surgical experience, so while we're up here on the second floor, let's go into one of our surgery suites that has been finished out and talk a little bit about that room. We're in one of our completed operating rooms, and Dr. McNamara should be feeling very comfortable and at home in this room. We have a lot of technology in this room, and I'm wondering if you could fill us in.
First thing is, this room is enormous. Every year we have more technology to bring into operating rooms, and we're always trying to jam it into a small room, and this is going to give us a lot of space for new technology to come. You also can see, if you look at the booms at the top, a lot of things are connected to the ceiling now, so they're easy to move. This is really going to decrease the amount of things that are on the floor, getting in the way as people move around, and allow a lot more functionality in the room. And really, when you get down to the bottom line, the more efficient the room works, the better it is for the surgeon to do surgery, for the employees to work here, and ultimately better quality of care for the patient.
All of this is designed to give patients and their families the best experience possible, using open spaces and light to bring comfort and warmth into the hospital. And nowhere is this more true than in the Healing Garden. Let's take a quick look.
Thanks for showing me the Healing Garden today.
Well, I know it's a place that's near and dear to your heart, and it's a space that was specially designed as an outdoor space for the enjoyment of patients and their families, staff, physicians, and volunteers. It's open to the elements, and we've got this beautiful water feature, one of two that's associated with the design of this building.
This is going to be a great outdoor space for everybody to use.
Well, we appreciate that you've joined us today for another New Main Tower construction update, and we invite you to stay tuned for more updates.